Good morning, everyone. Welcome and thank you for joining us for another HRG Outbreak Outreach webinar. We are so happy to have you with us this morning. Before we get started, just a couple housekeeping items. Feel free to ask questions as they come up in the question box in your control panel. To make sure that we honor the time that we've allotted for this webinar, I know it's 30 minutes, it's kind of quick, and it's a lot of information that Jason has for you. We're going to go ahead and have you answer those or ask those questions, and we will answer them in the email following up to this webinar. We will also include the slides as well as the webinar recording in that email as well. One more thing that we will have in that email is a survey that you can, of course, let us know how we're doing, but you can also request a certificate of attendance for joining us this morning if that is important to you. And without further ado, let's go ahead and get started with Jason. This morning we have HRG's Executive Vice President of OutPartnering, Jason Coffin. Jason has been one of our fearless leaders through the COVID-19 crisis, and he is going to be here this morning talking to you guys about how to navigate and manage self-pay through this crisis. So without any further ado, go ahead, Jason.
Yes, good morning. This is Jason, and I appreciate everybody joining this morning. I'm excited to talk to you about self-pay. Providing patient service and customer service is one of my passions. And so as we have experienced through this COVID-19 crisis, we're all coming up with different strategies to deal with that. And so this is an opportunity for you to share kind of what we've learned and what we're doing through that process. And hopefully you can take some of that and apply it to your organization as well. I'm hoping that you walk away with kind of three things from this webinar. The first one is we're going to talk about some different strategies or techniques that you can use, but really it's going to be up to you to assess those and really see what fits for your specific community and patients. I don't think there's one total strategy that fits the need for every single community. So really you need to do the assessment of your community, of your patients, of your communication plans and see what works for you. But I definitely encourage you, if you see something that we talk about on here that makes sense, to go ahead and deploy that to your patients as well. We are going to talk about best practices, specifically around some communications internally and to patients. And so I hope you have some takeaways around that. And then the final one, it's really about giving great patient service, but also continuing to get movement on your self-pay accounts. And I think every dollar that you can get from a self-pay patient really helps at these times as some of our facilities are having struggles with cash. And so really hopefully you'll get some techniques on how to continue to do that. So with that, I want to talk about probably the most important aspect of self-pay, and it's really the patient experience. You know, when a patient walks in the door, they get that great service, their bill gets billed to the insurance company. It's really that collection of the remaining patient dollars that's so important in giving them that patient experience. And really through this crisis, we need to remember to continue to give that patient experience. In fact, it's an opportunity to give even better patient experience, because our patients right now, at least the patients that are out there, a lot of them are scared. They're dealing with a bunch of different situations. And so this is an opportunity to help with that. One thing I think you can do is you can remind your staff and coach your staff and provide scripting to really provide that reassurance. It's an opportunity to make sure we provide more reassurance when we're on the calls with patients and talking to patients. Some ways they can do that are just continuing to use phrases like, we're here to help. We're doing everything we can to keep things running normal. Don't worry, I'll look into that for you. You know, especially patients that are calling in that are explaining maybe they have financial issues. So really reminding your staff to be calm, have that reassurance, reassure them about the facility, reassure them about the options that are available. And so sometimes we forget to do that. I know our own staff are a little bit uneasy about some of this that's going on too. So it's just a good reminder and good coaching to do that. And I think that will enhance your patient experience. The next one is, we know that there are patients going through financial struggles and there's different types of support for them out there, but some things you can think of or might be able to deploy or might consider that we've seen and we've used with some facilities is, one is it's an opportunity maybe to provide a prompt pay discount, a special COVID-19 prompt pay discount. I know some facilities are already running a discount during tax season. And so if you pay your balance in full during the tax season, we'll give you a discount on that. You can either continue to do that and call it COVID-19, call it a tax discount, whatever it might be, but an opportunity to encourage patients to pay you in full and give a discount to do that, because dollars now are important coming in as we're working through the financial impacts of this. Another strategy is to do a 60 to 90-day delay in bad debt. And I know there are some states out there, Washington, D.C. is one, that actually has put a moratorium on you can't send medical debt to bad debt for a period of time. And so I expect that we're going to see more of that potentially, where you can't send that to bad debt. But you may consider that, if it's right for your community, that, hey, we're not going to send anything to bad debt for 60 or 90 days. We're going to continue to just put it through the self-pay cycle as a way to help your patients. And the other one is, if you have a patient that calls up and they lost their job, they can't pay, but they can pay later, you could consider putting those accounts on hold. Your phone reps might be able to say, hey, we're going to put you on a special hold for 60 days. We won't send you any statements. We won't contact you. And then we'll reach out to you in 60 days and start the collection cycle too. So those are things you can do to provide that reassurance to patients from a financial standpoint. The other thing you can do is just make sure they have information available. Being able to have them have the ability to talk to somebody is important. They can pick up the phone and talk to somebody. Any information you can put on your website, especially around any financial assistance that you can provide them, is important. You can also put information on your statements, or you can put stuffers in your statement with specific information as well. So those are some strategies you can use to enhance the patient experience. The next one is patient statements, and you have to continue to send statements through this process. Statements are really your lifeblood. If you stop sending statements, you're going to disrupt that self-pay collection cycle. You probably will cause uneasiness to your patients. They may ask, what happened? Is the facility about to go down? I'm not getting statements anymore. What's going on? And it really looks like an issue with your internal processes, your facility. So I'm going to encourage you to continue to send statements. If you can't do the other stuff, you need to continue to send statements. And you can do things on your statements to really help your patients. The first one is, we talked about different types of financial support options you could use. There's probably other ones out there, but make sure that you update your policy and that you can support what you've updated it to do. You can add text to your statements or reassurance to your statements. And so I have an example of that. Here's an example text that we have put on some statements. The health and safety of our patients and family is our highest priority. If you experience financial distress due to the pandemic, we have options and we'll work with you to minimize those impacts. Please contact us at this number and we can help walk through those options. And so that's something you can maybe put as a dummy message on your statements. Maybe you could put a statement insert to do that, but a way to reassure those patients. You can also put a different number. And so if you have different financial counselors that are equipped maybe to walk through that, or one or two people that have that specific expertise, this is where you could put that different 1-800 number for patients to call those folks and talk through those options. Or you could just have them talk to your normal self-pay staff that are doing that. So from a patient statement standpoint, continue to send statements and look for ways to provide that patient reassurance on them would be a strategy that I would recommend. So let's talk about inbound calling. So this is the ability for patients to talk to somebody. So, they have a question, they want to make a payment, different things, are going to call that 1-800 number and talk to somebody. We're dealing with some different issues across the board in the country. And one of those is a lot of states are quarantined now. You can't be in the office, or you have to have very limited people in the office. And so that means a lot of people that were at traditional working hours may not be working, or people are working different hours, and our staff are working different hours. They're trying to work from home. And so one of the things you can do is really look at your schedules, right? Your demographics and your peak times may be changing as people are working from home or have different times. And so you may see a different peak time than traditionally when we had a workforce that everybody was out working. So I encourage you to take a look and see, has your peak times changed, and are you staffing accordingly to be able to meet those peak times? The other thing is, if you have a remote staff, if your staff has moved remote, based off different schedules, their scheduling needs may be different as they're working from home. And so you want to take that into consideration too, so that your folks taking phone calls can provide the best possible support for patients, and that we're staffing, those people to be able to meet the needs that might be changing from those patients. The next one is you want to make sure you're providing tools to your staff who are taking phone calls. And so if they're moving remote, that has its own challenges. You want to be able to have staff that are able to work remote or answer phone calls. And some facilities don't have that ability. And so if you currently don't have the ability for someone to answer phone calls from your patients, you need to find a partner that can do that. And there are several folks organizations out there that are providing that kind of support. You need to make sure that your folks from home have the ability to access your system remotely, because patients will have questions. And if they can't answer those questions when they call, that's not going to provide that good patient satisfaction we're talking about. So you want to make sure they have the ability to access your HIS systems, maybe your medical records, EOBs, so that they can answer those questions that patients might have. And then the other one is, even though we're in this crisis, we still want to be able to process payments when we're on the phone, and don't be afraid to ask patients for payments. But when they're on the phone with us, if they want to pay, we need to make sure the folks working from home can process those payments, and you have a mechanism to do that. Because once they offer to pay, if you can't take that payment at that point, you need to call them back, or you need to delay it. Sometimes that offer doesn't come back, and so you lose that money. So you want to make sure that the folks on the phone, if you can get a payment from a patient, you have the ability to do that, especially if people are working remote. The one thing you want to make sure is that you're PCI compliant when you're doing that. And so that's something you might want to check into. And then the last one is you want to provide some updated scripting. And so you may have patients that are asking about COVID-19 events locally or across the country. And so you want to make sure your folks have some reasonable answers around that. How's it impacting the hospital, or different things, or I want to, tell the nurses, great job, whatever it might be. You want to make sure they have some good answers to that. Another one is, as folks are working from home, they may have some distractions that are outside of their control, like their dog might bark, even though they're trying their best to control that. So you want to provide some scripting to folks in case that happens. Maybe they just explain, hey, I'm sorry, my dog in the background, part of this COVID-19, we're all working from home, and then just move on with the call. Most patients will understand. And then really it's about showing empathy and reassurance, continuing to show that empathy and reassurance. So on inbound calls, those are some strategies you can utilize. Here's some example scripting that you can use. The patient may ask, I'm not working, my job is shut down, how can I be expected to pay? There may be some patients that are upset because you're following up on that. And that's where really you go back and you talk about the options that are available. Hey, we have some options, let's see what we can do. Maybe there's some different payment plan that makes sense for them, or maybe there's some charity care that makes sense, financial assistance. And so you can see a scripting of an example of what you might be able to have your phone agents say. Another one is, how can the hospital be asking for money at a time like this? These are probably the two toughest questions that we see that folks get, and your ability to make sure your staff can answer these makes a difference to the patients. It shows that reassurance, but you're also showing compassion because you have options for them. And the answer to this might be, with so much need for medical care right now, we're working hard to keep the hospital function as normal as possible. Hopefully your community will recognize that you need to continue to pay for that service that they're going to depend on moving forward. And so those are some examples of some call scripting that we're using. If you have any other ones you need help with, feel free to reach out to us in the questions, and we can give you examples of what we're using for call scripting on specific situations. Outbound calling is a controversial one, and really we have been asked by several facilities to stop doing outbound calling. And I think for those several facilities, it has been because their community has been hit pretty hard by this. And so this is where that community assessment makes sense. But the majority of our facilities said, let's continue making outbound calling, and let's continue to try to collect that money because it's important. One thing I'd say is, if staffing's an issue, if you don't have enough staff to do the inbound calling right now, you're going to struggle to do outbound calling. But there are technologies that are pretty easy to deploy to text patients. And so if you can text information to patients, that's as good as doing an outbound call a lot of the time to really do that touch point. It might inflate your inbound calling, but at least people are calling and reaching out to you. You do want to make sure that you have consent to text patients if you're going to do that. Most clients have continued with outbound campaigns, but we've learned some things, and we've continued to do outbound campaigns. And one of those is our success rate of patients answering the phone and talking to people is higher. We are getting more people answering the phones when we call, and the calls are a little bit longer than we've seen historically. And I think that's because people are at home, willing to answer the phone. And in some regard, I'm going to say this tongue in cheek a little bit, they want someone to talk to, right? And so they're answering the phone, they're talking to people, they're engaged, and that's generating a lot of payments. They're putting a lot of things on payment plans, they're really working through situations. And I think that's really good, because I think this outstanding medical bill for a lot of people is just a pressing thing in their mind, and it's an opportunity for them to get some resolution to that. And so I think that's really important. So we're reaching more people, we're having more conversations, and we're seeing our payments result as part of that. And as I said, patients are appreciative. Discuss that with folks. And the other thing we're seeing is there is a lot of love for the hospitals right now and the work that everybody's doing in the facilities. And so we're also seeing people wanting to continue to support that. And so they're making their payments and they're making arrangements because they want to support their local hospitals. And so that's a real positive spin that when you first think about this, you don't realize it's there, but as you do more outbound calling, you realize that love and support's really there for your facilities, from your patients, because they need you more than ever right now. So we'll move on to actually getting payments. And so you need to be able to provide different ways for your patients. You should already have this, but I think it's even more important now, different options for them to pay, because you're still going to have those folks that don't want to talk to anybody but want to resolve this. So make sure you have an online payment portal that they can process one-time payments, or they can set themselves up for recurring payments. You also want the ability maybe for patients to receive statements electronically. There's some patients out there that don't want to get anything in the mail right now. So this is an ability for them to get their statements through email. So an option for them to do that. If your staffing is an issue, you might be able to deploy a pay by phone IVR option, so they can call and process a payment over the phone. And so that will be one less call that a physical person has to take to process a payment. And then the other one is, some facilities can't have people on site right now, or it's really tough for them and they have to limit the number of people on there. So looking at a scanning solution for physical mail coming in, so that you can continue to get that correspondence and some of those things from patients and continue to process it. If there's a way to get that through a lockbox or a centralized way to scan that, you can continue to move forward with that stuff and you don't have a backlog. The other one is itemized statements, finding a way to continue to send itemized statements out when patients ask for those, because if you can't address those two things, you're going to come to a big backlog when you can resume back into a building. And the last one is really being able for your reps to process credit cards over the phone. And it hasn't been an issue when they're on site, but there are some facilities that are struggling with that with their folks working remote. And so really it's working back with your merchant processors on different ways to be able to do that from a remote standpoint, and making sure that you're PCI compliant as you do that. Working from home has had its own challenges. I can tell you, I've had some learning curve with it, as I've primarily been working from home too through this. I think my dog Max thinks he works for HRG now. He comes to work with me every morning when I go to my office and sits there with me and pretty much sleeps. But he comes, and then at the end of the day, he walks and acts like he had a hard day. So I think he's liking working from home. But there's some things you need to think about. The first one is making sure you're HIPAA and PCI compliant. One of the things we do to ensure HIPAA compliance is we don't allow people to print from home, just because you can't necessarily safeguard that information once it's printed. And also making sure you're PCI compliant and you're not recording credit card information, on paper or in a database where it's not secured, and some of those things. So make sure you're compliant with your folks working from home. There are some specific scripting we talked about that you want to make sure you're giving to your folks, things like distractions. If they get distracted, what is the script in there? They may ask, are you at the facility? So there's different ways to answer that, such as, that's the beauty of technology, is we're able to deploy and work remotely during these times, different things like that. Your staff may have issues with system slowness, internet connectivity issues, limited access. And so if those are things they're struggling with, you want to make sure that you give them good scripting so you have a good message out there and it doesn't sound like you're not in control of those situations. And so that's a good time just in a team meeting to talk about, hey, if you get these kind of calls or this happens to you, these are the kind of things you can say about that. I believe that as staff are working from home, you need to make sure 100% of your calls are recorded. I think you should record 100% of your calls all the time, but I think it's even more important because you're going to need to rely on those to do quality assurance and a variety of different things related to that. I also think it's a good opportunity to increase how much quality review you're doing of your staff, because they're not sitting together, and a lot of times they are monitoring each other as they're all sitting together taking phone calls, and now nobody's together. And some of the information sharing that happens when they're all sitting and listening to each other on phone calls isn't happening right now. And so it's a good opportunity for you just to keep tabs on who's doing what, and really provide that extra coaching so you're giving that really good patient service. And then if you don't have a chat tool, I encourage you to deploy something like Microsoft Teams, if you have a Microsoft license, something like that, so that your staff have the ability to chat a supervisor or a lead when they have questions, because they're not available just to go ask anymore if they're on site. So make sure you have some sort of chat tool or way to do that for them to continue to ask questions and get that support, because that's tougher. The other one that I would ask you to do is communications is critical. And so have those team meetings often. You can either just call them up and talk to them individually one-on-one, or do 5 minutes before the beginning of the shift starts just to get everybody together and talk about stuff. But really keeping that sense of teamwork and that sense of communication is really important. So here's some final thoughts that I have really as we go through this. So it's about consistency. And we talked a lot of things around consistency. So making sure your statements go out, making sure you can continue to process payments, making sure that you have solutions available, making sure people are given the same answers no matter who they talk to. And so I think if you have gaps in any of those processes, it's going to impact patient delight. It's going to impact your collections. And it may also look like things are unraveling at your facility when they're not. And you want to give that very, I think, positive business process view of your patients to what's happening. And so this is the last touch with those patients a lot of times for that service. And so it's a great opportunity. Hey, we're in control. Everything's great. We're working through the process. So consistency is extremely important. You want to make sure your staff and your employees doing self-pay. I mean, we all know this is a tough job, right? And it's even tougher right now. So not only are you calling people and asking for money and working through solutions, but you're calling them during a national crisis and doing that. And so it's a tough one. And so if you don't give them the right support, you may have a hard time keeping them motivated or keeping them from calling in sick every day. So you want to provide the right tools. You want to make sure you're providing them a lot of that coaching, and it's easy stuff, the scripting and some of that stuff, so that they feel more comfortable and allow them to provide that good service. If there's limitations on what they can do and what they can access, you need to address that with them up front. Hey, you can't get to EOBs, but here's how you can get that information if you need it, so that they can manage those calls with those patients, because nobody wants to be on a call with a patient and not be able to provide that service. And so if they can't provide the service, let's make sure that we provided tools or communications around that. Community support's very important. I think we understand that. You want to make sure that you're providing information to your staff so that they can show that empathy, so they know what's going on. And if you get reciprocal support from patients, for example, calling in, hey, I want to support the doctors, or I want to send you 100 masks, or whatever it might be, that you have an avenue to up-channel that too. Because I also, if patients are willing to support you as an organization, there should be a way to get that information to the right folks. And so that's something else to remember is it goes both ways, right? The community wants to support you. You're also supporting the community. So how do you make sure you have those different communication channels set up? We talked a lot about financial support, and I think that's just going to continue to be a bigger issue and bigger issue. I think every week we see that there's more unemployed numbers out there. Eventually that's going to rebound, but right now I think it's going to continue to get worse. And so I think if we have proactive strategies, if we think about what options we can afford to do that and we offer those up front, that's a whole lot easier to manage through the process than just waiting for things to get to bad debt and when we haven't talked to those patients, and we may be forced to not be able to send stuff to bad debt anyway. So if we can manage that through the process, at least we know where we're at and what the plans are with those patients. And then the last one is just organizational maturity. I think we're all going to learn from this, right? So we've all learned how to deploy a mobile workforce if we haven't had one before. We've all learned how to use tools and technologies differently. We've all learned how to adapt our service models and looking at just changes in peak times. Maybe that's something that historically you've always had the same peak times because we haven't had a big change in demographics in some of these facilities. Well, now the demographics have changed because people's working hours have changed and commutes are different. And so that's a way to just mature how you look at some of that stuff. You'll be maturing in the way that you're maybe doing your QA program and your training because now you're trying to reach your agents differently. And so I think as organizations, we're just going to continue to mature. And I think this is a great opportunity to take a look at what you do really good, where your challenges are from a self-pay offering, and then what can you improve on so that when we come out of this crisis, you have an opportunity to be that much better in the service that you're providing to your patients. And so those are my final thoughts on this. Hopefully some of the takeaways you got, as Taylor said, if you have any questions about anything or anything we can help you with, please feel free to reach out to me on those and we'll get you any information that we have. Thank you.
Awesome, Jason. Thanks. You did a great job. All right, guys. Well, we appreciate you joining us as usual. We will be sending out these slides as well as the recording to this webinar later on today. That will also include a survey. We'd really appreciate it if you could just let us know how we're doing. If you guys have any recommendations on topics, we're going to continue doing these webinars through this entire COVID-19 crisis weekly. Next week, we're going to have Troy West talking to us about some 2021 E&M guideline changes for coding. So definitely get registered for that. If there's anything that we can help with, I will be sending out that email from my personal email. Feel free to send us questions and I will get you pointed in the right direction. With that, you guys have a great rest of your Thursday and we'll see you next week.